So in today's episode, I'm going to discuss about a very important topic, that is fumigation. Exactly what is fumigation, what does fumigation really means, and how a room need to be fumigated, what are the precautions we take while selecting an agency which will does the fumigations, and what's its importance. I'm Dr. Pratim Sengupta. Today I'll discuss about one of the most important aspect which need to be looked for the patient who are being transplanted. After transplantation, when you have been discharged from the hospital, immediately after transplant, we keep you in an absolutely sterile room, that is in the post-transplant isolation room. We maintain all forms of sterility there. Now you step down to the single cabin. That is also very nicely clean, isolated room. You are recovered well. Now you go back to your own home or in any place where you are living right now. We need to be very careful about preparing that room to protect yourself from infection. Do you know what is the most important challenge in transplant? The biggest challenge in transplant is post-transplant infection. And majority of the infection happens with a common, otherwise normal pathogen which lies everywhere in our rooms, which does not cause any problem in a healthy person. But after transplant, as we prescribe some immunosuppressive medications which otherwise brings your immunity down or suppress your immune system to some extent, so you are prone to develop some infection. Henceforth, we need to be very careful about protecting you by sterilizing your room, sterilizing your toilet, sterilizing the entire environment where we are living, so that you don't get any bad infection which can give rise to some serious complications. So fumigation is the process where we spray some special chemical in a gaseous form, and that spraying mechanism is done in such a way, in some special device, which ultimately leads all these pores, all these small cracks in the walls, rooms, below the furnitures, below the beds, wherever, everywhere, the hidden bacteria, viruses, funguses, whoever been there inside the room, they are killed by that process. So this is a very interesting and scientific way we can help somebody who is going to live in a place to make that room absolutely sterile, free from bacteria and viruses. Now, I have seen after transplant, people take the fumigation from wherever they want. Somebody says that I'll sterilize your room. There are so many agencies nowadays, and they comes and they tells that, okay, I'll make your room sterile, and the people take that thing. Please be careful. Do you have the right scientific data how the fumigation need to be done? There are so many things, because we were facing some frequent infection of some of the patients who have been otherwise discharged well. They went back to the home, and in a certain period of time, they get back or come back to the hospital with some infection. When we focused deeply in the why this is happening, we understood that the fumigation process, where the room where the patient is staying, is not accurately prepared. Henceforth, we will deep dive in this process, how it need to be done. The most important thing is when the fumigation need to be done. The fumigation need to be done at least 2 to 3 days prior your discharge. By that time, your room get absolutely sterile, and you can step into an absolutely safe environment where you will not get an infection. So now, another question comes to the patient's mind, that how the fumigation should be done. You don't need to think about. We have developed a specialized agency from our team, which develops this new fumigation services to your doorstep. They clean every furniture of your room. They clean every doors, your beds, and every possible areas where some bacteria, virus can stay. And then they spray a special chemical content, which ultimately kills all the bacteria, viruses, and everything. Henceforth, it is better not to take this load on your head. Just contact with our contact person, who will guide you how the fumigation need to be done. Now the question is, which is the best fumigation agents? We need to understand one thing very clearly, that regarding fumigation agents, there is a sea change in over the decades. Around 5-10 years ago, the majority of the fumigation was done with the formaldehyde. The formaldehyde is a very bad chemical, because it is a good in the sense killing the bacteria, but it is a strongly irritant. It is a very bad in smell, and a person cannot live in that room without irritation in their eyes for 4 to 5 days, and the smell is very stinking. It does not passes off easily. So we don't prefer formaldehyde anymore. Later on, any iodine-based compounds came, but they are also irritant to the body and they are also irritant to the eyes. Some bleach and chlorine-containing chemicals also came for the fumigation. That is also not scientifically proven to be very much good. So we have to keep a balance between the killing potentiality of the chemical to the bacteria, virus and funguses side by side is tolerance to the human body. We have to keep a balance. After a lot of research, we have found out quaternary ammonium compound, which otherwise used for the sterilizing OTs, are the best. And henceforth, we use that chemical for fumigating our patient's room when they are going back from their hospital to the home. Now, often people ask me whether the room where the patient is staying, that room to be sterilized or the entire flat need to be sterilized. My suggestion here is, it is better if you can sterilize the entire flat. Why? Because we do the transplant to give you some freedom. We don't expect that you should be confined in only a single room. You should come out from your room, go to your parents' room or go to your kids' room. So it is always better to fumigate the entire environment, entire flat. Maybe you have 3-4 rooms. It is better always if you can fumigate all the 3-4 rooms, which will give you a much more freedom to move and lesser chances of getting any infections. Regarding toilets, this is very, very important. The toilet cleaning, we use totally different chemicals, and toilet need to be cleaned at least 3 times in a day for the deep cleaning, and after every use it need to be flushed, and your toilet must be isolated for your use only. It is always better, prior you ship to your own house, dedicate one toilet for yourself, one toilet for the patient who has underwent for the transplant, because the toilet is the most important area from where a post-transplant patient get back to some infections. One very important mistake we have seen, a lot of patients do not know that the AC filter need to be cleaned regularly. Because the AC filter, they also carries a lot of bacteria, virus and fungus. They shower that to the AC vents. So it is often necessary in a periodic interval for the AC filter need to be cleaned, and it need to be washed properly, and it need to be disinfected so that no bacteria can make sit in that filter. Few months back, we have an incident happen to one of our patients. He was not aware that the AC filter need to be cleaned. He did the cleaning service from some local companies and all this stuff. They did not focus on that area, and the patient landed with a bad pneumonia. When we inquired and we inspected the room, we found that the AC is quite old and the filter is loaded with a lot of dust, bacteria and virus. So be careful about cleaning your AC filters in a periodic time. Another important issue, at what frequency you will sterilize your room by the fumigations. We recommend best is once in a month for the initial 6 months. Later on, once in 3 months is okay. And for the toilet, we recommend at least 3 deep cleanings in a day with special toilet cleaning agents which we provide for our patients. So I hope this information will be helpful for you, and please fumigate your room with the right chemical, with the right person who knows the science behind how to make the room sterile, and stay safe after transplant and live a long life without any infection.